Hello everyone, welcome to Bonnie's Perspective on Health. Every lady should not skip this because today we're going to learn about discharge, vaginal discharge. A vaginal discharge is a collection of fluid that is formed by the glands in our vagina and also a collection of other fluids that come out of our cervix and from the uterus. It contains dead cells, some mucus, all that bacteria that is good. It has about 3 importances. One importance being moisturizing. This place needs to be moisturized for very many purposes, including lubrication when we are doing the activity. It also helps us to clean up the V from all that here and where all that. That's what the vaginal discharge does. Also, it has a very big protective function as it contains a bacteria called lactobacillus that makes the environment, the pH a bit acidic so that the rest of harmful bacteria cannot affect our area. So every woman must have a discharge and must be proud of it, because just like the mouth has saliva, so does our V have a discharge. But there are abnormal discharges and there are normal discharges. Let's talk about these discharges that we have seen, or if you haven't experienced it, maybe another lady has experienced it. We have a white discharge or off-whitish discharge. It's creamy and a bit sticky, or maybe watery, or just in the middle there. No foul odor, it's not smelly, it's not itchy, and it doesn't irritate. If you have that discharge, it's absolutely normal. It could increase from time to time and decrease according to the menstrual cycle. Also, we have the glassy discharge, or what we call egg white discharge. This is also a normal discharge. It increases towards ovulation or during ovulation. It is really stretchy, most ladies have experienced this, I think, and very colorless and a bit much in volume. It's not itchy, it doesn't irritate, and it's okay, it's normal. We have another fluid, another discharge, which is pink. You can have a pink discharge on your pant liner or on your panty. It is good, or it may not be okay, depending on the time of the cycle you are at. If you've just finished your periods and it comes, then it could be considered normal, because that's a slight of blood mixed with our normal discharge. But if it is coming with before the periods, or that what we call light bleeding, unless you are on a contraceptives among the ones I described that can cause light bleeding, like the pill, then it has an alarm. Maybe that bleeding is coming from inside. Maybe it's a fibroid, who knows? Maybe it's a polyp. So you should go to the hospital and get checked. Then we have a coffee brown discharge. Normally happens as the period is starting. That is absolutely normal. And maybe it can also happen as an implantation bleeding when you've just gotten pregnant. So the coffee brown discharge is okay, except if it is smelly, if you have pain, lower abdominal pain, if you're having pain during sex, if it is, itching, or maybe, if that cannot be normal. Then we also have a white discharge that looks like spoiled milk or cheesy-like, having cramps in it. In most cases, it is itchy and there is irritation. That discharge is absolutely very abnormal, because it indicates that you could be having a yeast infection, candida maybe, Even if it's not itchy, that discharge is not okay. Get checked up and get treated. We also have a yellowish discharge. Sometimes it's smelly, and it could be an indication that you have sexually transmitted infections like gonorrhea, like trichomonas, or chlamydia. So if you have a yellow discharge, sometimes it doesn't come with signs of itching, low abdominal pain, or painful urination, or pain during sex, but it's not a good one. Go to the hospital and get checked. And it shouldn't cause alarm because it's treated, it's manageable. The next discharge is a gray discharge. In most cases, this gray discharge is watery. Its consistency is much more lighter than the normal discharges, and it smells like fish. A fishy smell, odor, not nice. This is an indication of an infection. It could be bacterial vaginosis, and it's important to go get checked and get treated. The next discharge is a greenish discharge. Sometimes it also has crampy things like spoiled milk, but some yeast infections can also bring out something like that. But also the sexually transmitted infections I talked about, gonorrhea, etc., they can also cause you to have such a discharge. Every woman must be aware of this information so that we can monitor our vaginal discharges, because they help us, they inform us about a lot about our health, which stages of our menstrual cycle we are at, whether we've conceived or not. It is important to study your discharge, and in case you get such discharges, know what to do. Get checked, get treated. If you've experienced one of those I described, or if I forgot something, please put your question or your comment in the comment section and let me know. Share it to your friends so that they can also get this information. Thank you. Bye.